An ostomy is a surgically created opening used to connect an internal organ to the abdominal wall, through which waste products, like intestinal contents, are eliminated. The opening that can be seen on the body surface is called a stoma, and it's usually connected to an ostomy pouch, also called a bag or appliance, where stool and flatus collect. An ostomy can be permanent or temporary, and it can be necessary because of fecal incontinence, an intestinal tumor, bowel trauma, and a bowel inflammatory disease. In these circumstances, part or all of the intestine is removed, and the remaining part of the intestine is brought up through the abdominal wall to allow for elimination of waste products. Now, depending on how much bowel is removed, an ostomy can be either an ileostomy or a colostomy. With an ileostomy, a part of the small intestine is connected to the abdominal wall. An ileostomy can be permanent when the entire large intestine is removed, or temporary when it's done to allow the large intestine to heal after trauma or surgery. With a colostomy, only part of the large intestine is removed, and the remaining part is connected to the abdominal wall. Remember that normally, in the small intestine, the nutrients are pretty liquid because most of the water is reabsorbed in the large intestine. So with an ileostomy, the feces are liquid, and they flow at a fairly constant rate. With a colostomy, on the other hand, feces have a different consistency depending on the location of the colostomy. So if nearly all the large intestine was removed and the colostomy is near the beginning, feces are more liquid. If the colostomy is near the end of the digestive tract, feces are more solid. Like ostomies, ostomy appliances also come in different shapes and sizes. There are drainable appliances, also called open-end appliances, which are sealed with a clip or a Velcro-type system at the bottom, so they can be drained and reused. Then there are closed-end or disposable appliances, which can be removed and replaced or emptied and rinsed when full. Additionally, some appliances are pre-cut, so they come in different sizes to match the various stoma sizes. For other appliances, you'll need to cut out the opening yourself. Another variation refers to whether or not the skin barrier is attached to the appliance. If it is, it's a one-piece. If it's not, it's a two-piece. Finally, the ostomy appliance can be connected to an ostomy belt, and sometimes appliance deodorant can be placed inside. Now, ostomies come in different locations and sizes, but no matter the type, there are some common care tips. Close the door and bed curtains and keep the person covered as much as possible for privacy while providing ostomy care. Remember that the skin around the ostomy is in direct contact with feces, putting it at risk of irritation. So, care should be taken to keep it clean. If you're using a pre-cut ostomy appliance, the opening should match the size of the stoma. If you cut the opening yourself, measure the stoma using a measuring guide, then trace the measurement on the skin barrier. Cut the opening a little larger than the stoma, so as not to put pressure on it. The ostomy appliance can be changed when the client is standing or sitting, and it can be done in the bathroom or while the person is lying in bed. For colostomies, choose a time when the stoma is not active to provide care, such as first thing in the morning. If you're providing routine ostomy care in bed, place a bed protector next to the client to prevent the linens from getting soiled. Make sure to use warm water for ostomy care, and make sure it's at a comfortable temperature by testing it with the inside of your wrist. And as a general rule, while providing routine ostomy care, dirty supplies go into a bedpan, and then you can dispose of them appropriately. Now, it's worth mentioning that in some states and facilities, registered nurses provide routine ostomy care, while in others, CNAs are allowed to do this as well. To provide routine ostomy care, you'll need some toilet paper, 2 pairs of gloves, a clean ostomy appliance and belt, a gauze pad, a skin barrier, a wash basin, soap and water, washcloths, and a towel. In order to care for someone with a pre-cut one-piece disposable appliance, first raise the bed to a comfortable working height and position the client appropriately to have access to the stoma. Before removing the appliance, observe what's in the ostomy bag and report anything unusual to the nurse. To remove the ostomy appliance, disconnect it from the ostomy belt if one is used. Then, hold the skin and gently pull the appliance from the top to the bottom. You can use warm water to remove the adhesive more easily. Place the appliance in the bedpan and use toilet paper to clean the stoma. Then, cover the stoma with a gauze pad and go to the bathroom to empty the ostomy appliance. Log the color, amount, and consistency of feces in the appliance. If they are in any way abnormal, refrain from emptying the appliance until a nurse has had a chance to inspect them. Now it's time to dispose of the old gloves. Wash your hands, fill the wash basin with warm water, and put on a new pair of gloves. Then wrap a washcloth around your hand to form a sort of mitt. With your other hand, remove the gauze from the stoma. Dip the washcloth mitt in the water, apply soap, and clean, rinse, and dry the skin surrounding the stoma. Now, it's a good time to observe the stoma, which should be a reddish pink and moist. Sometimes the stoma can bleed a bit when you're providing care, but that's considered normal. Inform the nurse if anything looks unusual or if there's excessive bleeding. You can apply a skin barrier, which can be a cream and or a wafer covering the skin for a 2-inch radius around the stoma. If using a cream, let it dry before putting the appliance back on. Next, you can put the ostomy belt back on as well as place deodorant inside the new ostomy appliance if used. Remove the back adhesive from the new appliance and center it over the stoma with the end pointing down. Press the edges on the skin and make sure there's a good seal to prevent leakage. Then, connect the appliance to the belt if used. Finally, when you finish assisting, check the client's clothing, gown, and bed linens to ensure they're dry and not soiled. Remove the bed protector and your gloves. And adjust the person's clothing to cover the appliance. Help readjust the client's position so they're comfortable and lower the bed to its original position. When providing routine ostomy care, you should report immediately if you observe any abnormal findings, like signs of skin breakdown or excessive bleeding from and around the stoma, as well as any pain or discomfort during the procedure. Document the date and time, the type of care, and the type of ostomy appliance that you used. Also document any abnormal observations. Alright, as a quick recap. An ostomy is a surgically created opening used to connect an internal organ to the abdominal wall, through which waste products like intestinal contents are eliminated. This can be done because of a tumor, bowel trauma, bowel inflammatory disease, or fecal incontinence. Routine ostomy care is done to check the state of the stoma, remove old ostomy appliances, clean the skin around the stoma, and to place new appliances. After the procedure, remember to report any unusual signs or symptoms to the nurse and document your observations.